Be Your Life po.
Hi everyone, and it's a beautiful day po. Today is February 6, that's a Saturday. And malapit na po ang Valentine's Day. I would like to invite everyone. We do own a floral company. Sa gifts po and sa mga nanliligaw at nagmamahal, please contact us on Anna York. Yes, kapangalan ko ho, Anna York Flowers on FB and Instagram. And we will be glad po to deliver yung inyo pong pagmamahal sa pamamagitan po ng mga rosas on Valentine's Day. So, Anna York Flowers. So, my name po, I'm Dr. Anna York Bondok. I am a pulmonary specialist and an internist po. I'm also a congresswoman, the mom po of an 8-year-old and the wife po of Mayor J dito po sa San Luis, Pampanga. Our topic for today po is cancer. So it's an ask all you can, ask all you want, ganun po, no? And why are we celebrating World Cancer Day? Well, because it's a very important na sakit po talaga. Marami po talaga. Next to cardiac disease, cancer is one of the major killers po talaga. And unfortunately, dahil po dito ngayon sa pandemic po, nawalan po ang ating focus on cancer. But kahit na po maraming COVID na po, and it's of course, as we know, a worldwide pandemic, hindi po nawawala ang sakit ng cancer. And siguro po, due to fear na rin ho ng mga taong pumunta sa doktor, nagkakaroon po ng later discovery because people are no longer having mammograms or screening. So nagkakaroon po ng problema sa sakit na hindi po nawala nitong panahon ng COVID. And I would say even lumala pa po. And that sickness po is cancer. Okay? So sa inyo po lahat, I invite you po to put your questions below. Sasagutin po namin cancer questions. Okay, pandemic po ngayon, we cannot escape from COVID questions. And even po non-COVID are very welcome. Pero sana po unahin po natin ang ating pong mga katanungan tungkol po sa cancer. Okay? And you can share po your experiences, your parents' experiences, experience po ng mga lolo't lola, or if something happened to you po na akala nyo ho cancer but it didn't turn out to be that way, or it was cancer at what's happening to you. We will read po those questions, comment on them, and hopefully po makapag-sharing po tayo para lahat po tayo, we will learn more today. Okay? Please na lang, of course, for privacy reasons, wag na lang pong ilagay or you could put your friend kahit kayo. But please do share because we will all learn from this today. Ako po, I'm a lung cancer specialist. That is what I was trained for in the US. That's the Memorial Sloan Kettering Cancer Center. So I think there are a few questions already and we are very open po na sagutin po yon. Again, please follow us, like and subscribe po. We have a YouTube channel. We are trying to reach 1,000 subscribers. At please, sumama po kayo doon sa YouTube dahil mas madali pong mag-search ng mga past episodes po natin sa YouTube. We have more than 300. Okay? So, come on, let's answer the questions po on cancer. So, good morning, Miss Reina, Miss Kathleen, at sa lahat po na nakikinig ngayon. World Cancer Day was February 4. Late na po tayo. But still, let's open the topic. Okay? Go.
Greetings na po ba tayo, Doktora?
I'm just waiting for you.
From Mizari Cruz
Marami na
Aguilar.
pong tanong. Why don't you broadcast them? O, sige, mga bati na lang muna.
Opo.
Okay.
From another viewer, why is cancer such a deadly diagnostic?
Well, malungkot nga talaga. And I think that's really a valid question. And another way of putting this question is, Doktora, pag nakatulan po ba ako ng cancer, diretsong babu na ba? That's how my cousin put it. And she actually has cancer. Or goodbye na ba? I would like to reassure everyone. Um, if there is one diagnosis po that we do not want to hear from a doctor, talaga pong the word cancer, nandyan na po talaga sa number one na ayaw po nating makinig, marinig, and that is a word po that strikes fear in the heart of everybody. Kahit na gaano po kayo katapang, if you hear the diagnosis at masabihan po kayo ng diretsahan po talaga, may cancer po kayo, may cancer po ang inyong asawa, may cancer po ang inyong mga magulang, may cancer po ang inyong anak. Talaga pong kahit ho kayo general or soldier or whatever po, kahit doktor, I've seen and given this diagnosis to fellow doctors po. I would really like to tell you, napapaupo po talaga yung mga tao at talagang nanghihina po. It's something that will shake you. And talagang I cannot even describe po the feeling na malalaman po yun to yourself or to somebody that you love. So this is often a common misconception naman po. Despite the seriousness of the diagnosis at hindi po ako ang magsasabi sa inyo, hindi, okay lang yon because it is not true. I would like to give a hope po to persons that ang tanong po niya, why is cancer such a deadly diagnosis? Well, because we have all had parents, close friends, acquaintances na nakita po nating namatay and they lost their cancer battle. So that alone po, it's deadly both physically, financially, psychologically, lahat na po, no? But I'd like to give hope po sa mga tao, especially nga World Cancer Day, ano? In this day and age, 2021 na po, no? The diagnosis of cancer is no longer a death sentence. Hindi na po siya talaga death sentence. Though it is a serious problem and talaga pong kailangan pong we have to give attention to this, matagalan din po ang gamutan, I'd like to reassure everyone na yung dati po nating inaakala na the moment cancer comes, patay na kayo, hindi na po totoo yun. There are various stages of cancer. Pupuntahan po natin yun. I thought I read a question. But definitely people who are stage 1 and stage 2 and even up to can be they can be cured from cancer. Those who are in the later stages, especially stage 4, may no longer be cured. Pero yung kanila pong buhay, they can live a very long and quite productive life pa rin po. So there have been many discoveries po, including mga biologics and different types of chemotherapy. And of course, because of the early screening po, mas maaga na po nating nalalaman ng mga cancers, it is no longer the same deadly diagnosis that we used to have. Marami na pong mga pagbabago in the way we discover and in the way that we treat cancer. So if someone would tell you that you would have cancer or that someone has cancer, I would truly understand po na manghina kayo. But again, I would like to assure you there is hope. Okay? So I hope kahit serious siya, I hope that I could give you some hope. Opo. Sa inyo
From
pong
Miss,
journey through cancer.
yes, from Miss Lareg S. Olivmos. Maya Pabak po, Doktora, watching from Los Angeles, Pampanga.
Oh, wow, ma'am. You're in the US. I hope you are safe. Thank you po.
Another question from one of our viewer. Bakit po may mga stages ang cancer?
Ayan na nga po ba. That is the question that I got earlier on. What is staging and why do we stage cancer? What is stages? Stages po is the degree of seriousness or the degree of spread, in other words po, of the various cancers. Okay? I would like to say this, baka hindi po alam ng mga tao to, and it's a frequent misconception. The word cancer is not one diagnosis. Hindi po isa lang po yung sakit na yon. I hope it is clear to everyone, but I know that it is not clear to everyone, kaya sasabihin ko po ito. Ang sakit pong cancer, hindi po iisa yan. Okay? What is the meaning po of cancer as we know it, and then I'll go into the stages. Cancer po, what's the pathophysiology po of cancer? Cancer po is an abnormal growth of cells. Hindi na po magiging normal yung mga cancer cells. They are not normal. They are cancer cells. And the word cancer means a rapid spread. Opo, lumalaki at kumakalat. Okay? So, there are different kinds of cancers. Halimbawa po, breast cancer is a different disease from lung cancer. Lung cancer is an entirely different disease po from colon cancer. Colon cancer po is a different disease from leukemia, but they are all cancers. Ang meaning nun po is that somewhere, somehow, a cell in our body nagkamali po ng division and it became a super cell. Super not in a good way, but super in a bad way, and it manages to perpetuate itself, multiply, and eventually po take over your body. Nakakatakot, ano? But that is what a cancer cell is. So why are there stages? Okay, why are there stages? So pupuntahan na po natin yung stages. So the stages po, yun po yung gaano po kakalat o gaano po kaseryoso ang sakit po ng cancer ng isang tao. So we start po from stage 1, which is the mildest, to stage 4 po, which is called metastatic disease. Or stage 4, kalat na po ang cancer from the point of origin. Okay? So puntahan mo natin sa stage 1. How do we stage cancers and why do we stage cancers? We stage cancers para po malalaman po natin kung ano po yung dapat, number 1, treatment, and number 2, prognosis. Ano po, if you are stage 1, meaning, or stage 0, meron pa hong stage 0, that means your cancer is at an early stage, or it was discovered early, or it was discovered na wala na po pala kayong simptomas at konti pa lang ho yung mga cancer cells sa inyong katawan. Okay? So the treatment po of stage 1 is different from the treatment. So palala ho siya ng palala until we get to stage 4. And as I said, stage 4 is kung saan po nag-umpisa yung cancer nyo, kumalat na po sa ibang parte ng katawan. So the treatment for stage 1 is different from the treatment of stage 4, and the prognosis of stage 1 is extremely different from the prognosis of stage 4. What is prognosis? Prognosis means po, ano po ang mangyayari sa inyo? What is your future? Or tatanungin po nila, ano po ang ating hinaharap bilang isang cancer patient? So in English po, the term is prognosis. Could you type it? Prognosis. Okay? So, prognosis. Prognosis. So, ang meaning po nun, if you are stage 1, early stage, bagong discover, hindi pa ho kalat, kung sa breast nag-umpisa, nasa breast pa lang po, ang meaning po nun, the treatment is usually, for stage 1 and early stages, is usually cancer surgery. And the prognosis of that, or yung mangyayari po sa iyo, we usually talk about prognosis in terms of 5-year survival. In 5 years, buhay pa buho kayo. Usually, the prognosis of someone of stage 1 is really quite good. So yun po yun. I'd like to give everyone hope na yung tinatawag po natin deadly diagnosis, if you get diagnosed with stage 1, in most cases po, you can receive complete treatment, you can be cured, and your prognosis for the next 5 years is very good. Okay? As i-contrast po natin sa stage 4, stage 4 is metastatic cancer. Ang meaning po ng metastasis, kumalat na po from the point of origin. Let's start with breast. Kung sakali pong breast cancer po kayo, kumalat na po sa baga, possibly kumalat sa utak, possibly kumalat po sa liver. And the prognosis, the treatment of that is different. Hindi na po siya pwedeng operahan dahil wala na po tayong mahahabol. Naunahan na po tayo ng sakit. It is all over the body at hindi naman po natin pwedeng tanggalin lahat. Ano po? And also, the prognosis po of a stage 4 patient, Is that patient going to be alive in 5 years from the diagnosis of cancer? The answer is usually lower. Okay? So it's better to be stage 1 rather than stage 4. But again, I would like to emphasize, kahit na stage 4 po kayo, and I usually say this stage 4 can no longer be cured. In other words, hindi na ho namin pwedeng tanggalin ang cancer sa katawan nyo at ilabas and tell you, go home, you are cured. Stage 4 is usually po maintenance na lang po ng lifestyle at buhay ng tao using chemotherapy. So that's the reason why we have stages. It is to determine treatment and to determine prognosis. How do you stage? Marami pong factors that are taken into account for staging. Iba't iba pong cancer, iba't iba pong staging. So puntahan na lang po natin ng breast. Meron po tayong carcinoma, DCIS, carcinoma in situ, and then depending po on the size of the lesion, ginagamit din po yon. Depending po on the lymph nodes and kung saan po kumalat, we go through stages 2 and 3, and finally stage 4 po is spread outside of the breast. So that's the reason po why we have staging. Okay? So if someone tells you I'm stage 1 and I'm cured, that's good. If someone tells you I'm stage 4 and undergoing chemotherapy, that's not so good, but meron pa naman din hong pag-asa.
From Miss Nanita Babadilla Reyes, kailan po ba dapat magpa-test para malaman kung may cancer? Kasi po members of my family na diagnose na may cancer is too late na.
Ma'am, this is a very excellent question. And can you please type this? This question has to do with what we call cancer screening. Screen. Okay? What is the meaning po of cancer screening? Okay. And how has cancer screening helped us po in the battle against cancer? Ayan po, cancer screening. Okay. Puntahan po muna natin yung sinabi po ni Ma'am Nenita that many of her family members, pag na-diagnose na po ng cancer, usually may simptomas na pong nararamdaman, and then by that time, it is usually too late. Okay? Tama po yan. Okay? Let's go po into one of the most common cancers, which is breast cancer. Okay? And what we know po now to be called breast cancer screening. Okay. First of all, puntahan mo natin yun. Let's just assume na yung familial cancer or yung cancer po na marami po yung mga members ni Ma'am Nenita is breast. Hindi ko sinasabing breast ha. Pag-usapan lang natin yung breast dahil yun po talaga yung naintindihan ng mga tao and it's quite common. Okay? So breast cancer po talaga is hereditary. Ano po ang meaning nun? Kung yung nanay niyo po had breast cancer and your sisters, most likely po, kayo po have a higher risk. I cannot say it's 100%, but definitely po, you have a higher risk of developing breast cancer po as the sister and the daughter of breast cancer patients. Ako po, my mom had died of breast cancer, so I have a higher risk po of breast cancer. Okay, so knowing that, okay, nabanggit po, puntahan natin yung statement, by the time po that we have lots of symptoms, in other words, malaki na po yung bukol, or may nakakapa na po tayo dito po sa ating kilikili, worse, maybe in our neck, or hirap na po tayong huminga because maybe may tubig po tayo sa ating baga. These are all signs of late breast cancer. In other words, talagang halatang-halata na po na kailangan na po tayong pumunta sa doktor. And so they get diagnosed late and at a later stage in their disease. So cancer screening po is a form po of determining who is at a higher risk for cancer either due to their heredity or their age. Older people po are more prone to cancer or due to various risk factors, let's say for example, smokers and drinkers. So kahit po itong mga to na-identify po natin silang possible high-risk patients, kahit wala pa po silang nararamdaman, they feel perfectly okay. They should undergo tests po for cancer screening. So let's say you have been identified or sabihin na natin I have been identified as a high-risk patient for cancer screening. These persons po, the normal cancer screening that they would suggest po talaga there is a debate po sa US between the age of 40 to 50, ano. No, in fact, people are moving towards a younger screening. Um, People say po na if you do have a family history of breast cancer, your mom, 10 years po before the age that your mother was first diagnosed is the time po that you should start cancer screening for breast cancer, or by the time you reach the age of 40. So for example po, so ang meaning po nito is, kung meron po kayong family history of breast cancer, maaga pa lang po, kahit wala po kayong nararamdaman and you feel totally okay, you need already to schedule a mammogram para po, and possibly a breast ultrasound, para po kahit, it's very important, this concept na kahit wala kayong nararamdaman, then you need to undergo tests for cancer para po malaman po nila, since you are a higher risk, ano po, malaman po nila whether or not you have cancer at maaga po nating magagawan po ng solusyon. Because as Ma'am Nenita says, by the time ang laki na po ng bukol at nakakapana po natin, hindi na po kayo stage 1 at that point. You might even be stage 2, 3, o kung may tubig po sa baga, 4. Okay? So it is very important po every year to know your cancer risk, and to know po yung mga there are international and national recommendations po kung kailan po dapat magpa-screening for the various cancers. So, yun po yun. I hope
From
I answered the question. Opo.
from Mizari Cruz Larin, paano po nagsisimula ang cancer?
Ma'am, this is a very beautiful question. It's something po that scientists are learning and studying every day. Kasi po, there are various ways po. I'll just tell you the most common. But there are various ways po that cancer develops. Okay? As I mentioned po, cancer starts from one cell po that mutated. Parang COVID, ano? Basically, as our cells po keep continuously dividing. Okay? Our cells die and divide, parang ano ko, there's a growth ano ho, for the cells. How do I put this? There is a lifespan. Yes, opo. Our cells are constantly being formed, and our cells are also getting older and being destroyed. Okay? So, ang meaning po nun is, as your cells keep dividing in your body, and this is a normal phenomena po talaga that's happening every day as we speak, there will come a time po na by mistake, magkakaroon po ng wrong division. Diyos ko, ano bang wrong division? Magkakaroon po ng changes. There will be slight mutations or changes in the genetic code po of our cells. Sometimes, these changes may cause the cell to become what we call an abnormal or cancer cell. And this cancer cell po, parang nagiging super bad cell siya. And it will keep on dividing. And because of the certain genetic changes, iba na po siya. Like the breast cancer cell is no longer a breast cell. It is a breast cell na nagkaroon po ng mutation and nag-iba na po siya to become a super cell. And lumalaki ho na, dumadami yon. And that is the hallmark po of cancer, which is a cell which is different from the regular normal cells, and a cell that is just so strong and constantly dividing to eventually take over that organ and spread throughout the body. So yun po. These mutations or these changes po in the genetic code can occur by themselves. And this is why cancer po is a disease of older persons. Kasi po, as our cells divide millions of times during our lifetime, and sa dami lang po ng divisions ng ating cells as we grow older. Siyempre, yung dami ng cell division ng 5 years old, iba ko yung dami ng cell division ng 95. Si 95, probably how many millions of divisions na po yung kanyang cell, ano? So, sa millions of divisions na yon, nagkakamali po talaga. There will be mistakes in the DNA and RNA sequencing, and that is what can cause cancer. Okay? There are other factors po that can cause a cell to misdivide or to mutate or to have a mistake po in our DNA, and siguro that's another question later on. Okay? But basically, yun po yun. That is the guiding and basic principle po of cancer.
From Miss Kathy Rodriguez, how would you know if you have cancer?
Ang ganda rin ng tanong na to. Ma'am Kathy, this is a beautiful question. And sa mga oncologist po at sa mga doktor, there is a saying that tissue is the issue. Okay, what does that mean po? Or walang biopsy, walang cancer. Okay, so ganito po yon. Okay, we undergo the cancer screening. O, puntahan na lang natin si lung cancer naman. Okay, let's say po you had a cough and then in x-ray po kayo and then it turned out na may bukol po kayo sa inyong baga. Okay. So you are a history, you are 58 years old male, and you have a 20-pack year smoking history. In other words, you have been smoking 1 pack a day for the last 20 years. So matindi po yung risk factor nyo. You're already an older person, you're a smoker, and you now have a lung mass. So my question to you is, when you go to the doctor, you will ask the doctor, Doc, cancer po ba ito? Okay. So that's a very valid question. How do you know that you have cancer? Well, from the chest x-ray po ba, can we already determine that someone has cancer? Um, from from the mammogram ba, malalaman na ho ba natin na may cancer yung tao? Well, all of these screening tests po and radiologic tests, they can give us clues. Meron silang nakikita sa loob ng katawan natin. That may usually is what we call po a bukol or tumor, or in English, what we call a mass. Okay? But you cannot make a definitive diagnosis of cancer po unless you undergo a biopsy. And I think we discussed biopsy in medical word of the day, letter B, ano po? Ang biopsy, kukuha po sila ng laman. Yung nakikita po nilang tumor on chest x-ray, yung nakikita po nilang bukol on the mammogram or nararamdaman nyo pong bukol, kailangan po kukuha po sila ng laman, whether it will be from surgery or tutusukin po. Yung laman na yon, dadalhin po sa laboratorio. They will look at it under the microscope. May mga staining po. And that is process is called the biopsy. And only after the biopsy can they 100% tell you po that you have cancer. So if something looks weird on the chest x-ray, mukhang may bukol po kayo, nakakapa, may nakita po sila sa colonoscopy, may nakita po sila sa ultrasound, until we do a biopsy, we cannot 100% po say that you do or that you do not have cancer. Okay? Thank you so much po. Magandang tanong. So, eto lang, corollary to that question, kung meron pong nakitang abnormal sa chest x-ray nyo, don't panic like screaming na you have cancer. Marami pa pong mga possibilities for a mass, for a tumor that are not cancer. So, pero, hindi naman ho pwedeng mag-alaga po tayo ng bukol. No, no, no. Okay? Kailangan po magpa-biopsy po tayo sa doktor para malaman po natin kung ano po yung problema and whether or not it is cancer. Okay? So, a word of hope. Marami po mga bukol sa chest x-ray, sa ultrasound na kinakapa, nakikita that turn out not to be cancer. So, we have to know. Okay?
Okay. From another viewer, Dr. Ana, anong symptoms kapag po may breast cancer ang babae? From Ramil Sago.
Ay, Ramil? Thank you, Ramil. I think Ramil is a guy, but that's a good question for a guy or a girl to know. And I would like to let you know, though majority of breast cancers occur in women, there have been breast cancers that occur in men. And I will go to that later on. So, the most common po talaga sa breast cancer that I hear and happened to my mom po, to my cousin, may nakapang bukol. Okay? May nakapang bukol. And as I said also earlier, marami naman pong bukol na nakakapa anywhere, that, especially in the breast, that could be not cancer. So what to do po kung may nakapang bukol is immediately po go to your doctor, usually a surgeon. They will order po the initial test, which is a mammogram and an ultrasound. kung may makikita po talaga silang kakaiba po doon, based also on your family history, your age, yung risk factor nyo po for breast cancer, they may recommend either an open biopsy or a needle biopsy. So yun po, the number one na masasabi po sa breast cancer, may nakapapong bukol. Okay?
From Miss Lareg S. of Olivmos. Doktora, ang cancer po ba is genetic or lifestyle?
Napakagandang tanong ito, and I think that we are still answering this question to this day. Scientists, doctors, health professionals, pinag-aaralan po natin ito. And um, let me put it this way. Some of the cancers are genetic. Like there is a definite genetic link po between breast cancer, your mom and your sisters, colon cancer from your father po and male relatives. And yun po yun. And certain cancers do have very strong genetic predispositions. Other cancers naman po are not really genetic. For example po, lifestyle naman po that could cause cancer. Of course, we do know smoking po as the number one cause or the number one, not I wouldn't say cause, contributing factor po sa mga cancers. We also know po excessive alcohol intake can increase po bladder cancer and esophageal cancer, gastric cancer po. Um, Other lifestyles, yung ano po, some lifestyles predispose us to sexually transmitted infections like HPV or human papilloma virus, which ano po can cause cervical cancer and anal cancer. So yun po yun. And then ang dami po. So one of the questions that people often ask me also as I go around po is, Doktora, hindi kaya bakit po nung unang panahon, people did not get so much cancers? Is it because of our modern lifestyle? That could really be po true. We consume much more red meat, much more processed foods. May linkage po yan to heart disease, but there is also a definite linkage po to certain cancers. Our lifestyle. So, my answer po to that question is bakit po nung unang panahon, people, parang ang dami ng cancer ngayon. Okay. That is also due po to what's happening po in our modern society. Nung unang panahon po, people died of infectious diseases. Maniwala ho kayo, this pandemic thing, kasi po 2021 na, so we think there were no more pandemics. But nung una pong panahon, you can ask your lolo or your lola or your parents, talagang common po yung mga infectious disease pandemics nung unang panahon. And people always died of nung unang panahon. And I don't know if you notice this, when you go to the cementerio noong mga 1930, 1940, ang dami pong bata na linilibing. Okay? So, what do I mean? And people died of TB talaga noon. People got seriously ill from polio, measles. People were, ang daming pandemic. Okay? So, ano yung relationship nito sa cancer? Noong unang panahon po, people died of infectious diseases. And they were not very old. Marami pa pong batang namamatay of these preventable diseases. Ngayon po, because of vaccines and of course, the modern medicines na po, no? We are all, our median age po sa Pilipinas is now 74. So that means po that most people are surviving up to old age. And as I mentioned po to you, cancer is a disease of advanced age. So yun po yun. That's what I would say. Yes, some of it is genetic. And yes, some of it is lifestyle. And yes, mas nagkakaroon po ng mga cancer ang mga tao ngayon because dati po namamatay sila ng TB, polio, and measles. And ngayon wala na po yun. So they're now dying of cancer and lifestyle diseases like heart disease. Okay?
From Miss Marilyn De Jesus Cortez. Welcome back,
Hi,
Miss.
ma'am. Ang gaganda ng mga tanong ni ma'am. Okay, let's hear this, please.
What are the warning signs na may cancer na isang pasyente, doktora, bago pa man ma-diagnose na may cancer po?
Well, a few warning signs po that would trigger you to go to the doctor. Okay? But before we go to the warning signs, eto na lang po muna. I would like you to think about your family history. Okay? Sa akin, that's the number one warning sign. And I always ask this po when I meet a patient for the first time. And I always ask this again when I meet the patient for the 10th time kasi baka nakalimutan ko eh. So I need to be refreshed talaga. And I do believe po that your future lies a lot in your genes. So ano po ang cancer ni daddy? Ano po ang cancer ni mommy kung meron man? And lolo and lola. Also brothers and sisters. So talagang your genes will determine po a lot about you. So knowing your family history, kung may family history ho kayo ng breast cancer, magpa-mammogram na kayo. Kung may family history po kayo ng colon cancer, magpa-colonoscopy na po kayo. Okay? If you have been living with someone who has been smoking naman po for the past 30 years in your presence, magpa-CT scan na kayo because lung cancer is a distinct possibility. So, yun po yun. Warning signs, number one po, losing weight, okay? Rapid weight loss is one of the number one cardinal signs pa rin po of cancer. And of course, there are other reasons po for weight loss. Pero yun talagang malakas po kayong kumain. In the beginning po, na-excited pa yung mga tao, pumapayat sila. But later on, when they found out that the reason pala is cancer, it is not a good thing. Okay, so weight loss. Number two po, matindi pong panghihina. If you feel very weak and there is also no possible explanation, a workup of cancer might be indicated. Lalo na po the blood cancers, talagang fatigue po talaga yung una dyan. Okay? Number three, and this is so obvious talaga, kung may nakakapuha pong bukol anywhere in the body, may bukol sa leeg, lymphoma. May bukol po sa suso, breast. Basta ho may bukol near the bone, let's think of sarcoma. So, mga tumor, masses, bukol, lalo na po yung matigas at bago po at lumalaki, you need to see a doctor. Nabanggit ko na po yung breast mass. Ano? Another one is blood in stool po. If, at saka po, anemia, I mentioned this na po sa CBC, warning sign po yan ng colon. Okay? Masakit, blood na umihi, aside from stone, we look into bladder cancer. So, yun po yun. Unexplained fever, halimbawa po, fever of unexplained origin, lymphoma. So, yun po yun. Those are pretty much it. Nawawala ang boses, lung cancer. Ayan po. So, yun po yun. Those are the basic things that a person needs to know to investigate po. Nahihilo, frequent headaches, brain masses. So, yun po yun. Thanks for that very relevant question, ma'am. At kung meron po kayo nakakapang ganon, please go to the doctor as soon as possible.
From Mizari Cruz Larin, ano po ang 4 na uri ng cancer?
Sorry. Rina, sorry. I just mentioned mga I'd like to mention female cancers. Yung abnormal bleeding, halimbawa po, may menopause na po kayo, then bigla ko yung dinudugo, uterine cancer. Lumalaki yan tiyan, ovarian cancer, or metastatic cancer. Okay? Sorry.
From Mizari Cruz Larin, ano po ang 4 na uri ng cancer?
4 na uri. Marami ho talagang uri ng cancer. It's not only 4. Oo. Though I have to tell you, when I worked in Sloan Kettering, which is the #1 cancer center po in the world in New York City, we used to classify cancers as solid and liquid. Okay? Medyo mahirap intindihan, ano? Solid cancers, yun po yung lung, breast, colon. Liquid, lymphoma, and the leukemias. Okay? So that's how I was trained in a cancer hospital. So that's, if you ask me kung ano po yung mga uri ng cancer, I would tell you solid and liquid po. Okay?
From Ms. Kathy Rodriguez, how long does it take to go from stage 1 to stage 4, Doc Ana? Maganda po yung tanong niya.
Ay, ma'am. People do ask me that a lot. Okay? Maganda talaga. And my answer, Miss Kathy, this is something for us to think about. My answer po talaga is it depends on the cancer and it depends po on the aggressiveness of the cancer na tumama po sa inyo. There are cancers that are notoriously slow growing. In other words, mabagal sila. Okay? You can go from stage 1 and stay there for a really long time. And it's slow growing, okay? Mga indolent lymphomas po ang tawag dyan. Sometimes yung iba po, ino-observe lang po. Because it really takes time for them to progress and some may not even progress, okay? There are some naman po talaga na mabilis. Some of these na mabilis is meron pong form of very aggressive breast. Within 6 months, that person could be dead. From stage 1 to stage 4, ang bilis po talaga. Or from stage 3 to stage 4, ang bilis. So, yun po yun. And cancer that we don't know where it came from and kalat na, ang bilis din po noon. Um, Eto lang and this is something for, I guess, for pathologists. The more undifferentiated the cancer is, parang mas mabilis sa amin eh. Yun. So, it depends on the type of cancer. It depends on the morphology or the aggressiveness of the morphology po of the cancer that you have. So, I guess it is also individual po sa bawat. So, you have to each, what do I mean by this? Ang meaning po nito, yung breast cancer nyo is not the same as the breast cancer of your tita, is not the same as the breast cancer of your kapitbahay, and it's not the same as the breast cancer of your best friend. So each diagnosis is unique and should be evaluated po individually. Okay? So just because your kapitbahay, do talagang meron ho mga mabibilis. Another one is esophageal and pancreatic talaga, ang bilis. So, what I could tell you is, again, don't lose hope. Someone will tell you, yung kapitbahay namin na breast cancer, in 6 months she was dead, ganon. Tapos nahimatay ka na. Don't po generalize from person to person na pareho. So each case will be unique and you have to meet individually po with your doctor and talk about your case. Okay? Kasi marami ho talagang magsasabi, yung kapitbahay naman ganyan o yung kapatid ko, ang ganon. It's different for everyone. Okay?
From Mr. Mark J. Good morning, Dr. Anna. Will you recommend low-dose chest CT scan? How accurate as screening for lung cancer? Even if during chest x-ray ay clear po for someone who is chronic smoker, mga 25 packs years, elderly. Thanks po and God bless.
Thank you for this question, Mark. And I hope that those who are smoking, with relatives who are smoking, husbands who are smoking, please listen to this question. It is a beautiful and a question and a warning rin po to everybody. Lung cancer. Yan yung tanong. Okay? Frequently po, I just want to give the history. Lung cancer po is one of the largest killers po talaga in terms of cancer. It is not the most common, but it is usually the most deadly. And one of the major issues po talaga sa lung cancer is that the symptoms like inuubo, nahahapo, masakit ang dibdib, pag x-ray po o pag CT, talaga ang laki na po ng tumor. And I always tell people this term na tridor po yan. Kasi so many people come and tell me, Doktora, how did this happen? I promise I didn't feel anything bad. And then I have like a golf ball in my chest. My God, paano ito nangyari? And I would also like to tell patients talaga na, wala ho kayong ginawang masama. Ang lung cancer po talaga, tridor na sakit yan. How do I say tridor? What do I mean by tridor? Parang you can be feeling so well and then bigla na lang pag x-ray, ang laki na po. So, it happens po talaga. And usually, by the time you are feeling symptoms, like tinanong nga po earlier, it is usually stage 3B, 3A, or even 4 na po. Okay? So, because of that, scientists and doctors have been searching for a way to find po an early screening of lung cancer. And wala pang nararamdaman yung tao, dapat alamin na po natin kung may cancer sila o hindi. Because early stage lung cancer is curable po through surgery. So, in the late 1990s, na-develop po yung what we call low-dose CT scan screening for lung cancer. And it came out of Cornell University. or New York Cornell. In fact, we met one of the gurus po of screening. So what's the principle po do? Principle, not principal, principle. Okay? Could you please type in lung cancer screening, no? So ang ano po doon is i-identify po natin the persons who are high risk for lung cancer, and that every day, not every day, every year po, they should have a baseline CT scan, usually by the age of 50, ayan po. And then, every year po thereafter, titingnan po kung may nade-develop po nodules in their lungs, or if the nodules that are already increasing po, o if the nodules lumalaki o dumadami. Pag lumalaki po o dumadami, those nodules should be biopsied, and if they turn out to be cancer, then they should be removed. So yes po, low-dose CT scan screening has already been proven po to be an effective screening for lung cancer, especially po those with many, many pack years of smoking. So thank you, Mark. For those who are smoking, ayan, it's a warning. Stop na po.
Okay, next po, Miss Kat. From Miss Nanita Bobadilla Reyes. Too late po na nadadiagnose, as in yung tanning talaga na binigay sa kanila is ganun po talaga lang nagtagal. So I think, Doktora, this is the same person who asked earlier.
Yes,
So,
yes.
opo.
Yes.
Yes.
Okay, what is the meaning of tanning na lang? Oo. This is a unique, I think tanning means prognosis eh. Pero sa Filipino po, it usually means bad prognosis. And people always ask us, Doktora, how long? Kahit nasa ICU na po at nakahiga na po si Lolo at Lola and talagang comatose, everybody asks the word, how long? Ang hirap eh. Ayoko po talagang mag-tanning because when people step out of the clinic, parang talagang yung mukha nila, Reyna, it's just terrible. And then they tell you, may tanning na po kami. Oh my God. So, and sorry lang people sometimes, when I was younger, and people used to show me x-rays sa mga barangay, and some people don't want to believe me. And then, yung barangay captain namin would always say, nako, maniwala kayo kay Doktora, wala pa akong nataningan niya na hindi namatay. Isn't that terrible? Ikaw, Reyna, oh my God. So, what I could say po na the word tanning, mahirap pong mag-tanning, and it's hard to accurately give how long. What I could probably suggest po to persons is to explain the staging, to explain po what usually happens, and to explain po with honesty and compassion. Kasi importante talaga sa Pilipino is how you deliver the bad news talaga eh. So, yes, I would say, ayoko talaga mag-tanning. 6 months ka lang, 1 year ka lang. But what I could tell you is you are already stage 4. This is known to be a serious disease. Naubos na ho lahat ng chemotherapy. And we just have to really be honest. Pero mahirap at malungkot. Ikaw, Reyna, do you wanna share anything about telling people the truth of their cancer diagnosis?
Ako talaga, Doktora, ang hirap ako sa topic niya yan. But bravery comes courage. Kami kasing mga nurse, bawal talaga. Pero pag umiiyak na yung pasyente and the group, the support group sa amin, naiiyak na lang kami. Mahirap kasi siya. Mahirap siyang, it's real, even sa mga relatives, no?
Mabigat.
Yes, mabigat. Kami kasing mga nurses po, para lang po sa kaalaman ng mga viewers natin, we are not allowed to divulge any information. So ako, nadala ko yon, Doktora. I had 2 relatives who died of cancer. Hindi ko siya talaga kayang, siguro nasanay ako na hindi ko pwedeng i-divulge any information. Pero, ang greatest learning ko from there na nakuha ko is how to be very supportive. Yung support, yun. Kahit hindi mo explain sa kanila kung anong nangyayari sa kanila or what type of cancer they have, or if they really have, the support, it means a lot to them. Sobra kasi yung when in a family, when a person is diagnosed of a cancer, usually the support groups or the family members or the immediate relatives, sila yung nagkakaroon ng ah ano bang tawag dun, doktora? Sila yung nagkakaroon ng parang mental problem at saka secondary health problem, like sila yung nagkakaroon ng anxiety, nagkakaroon sila ng na nabubuo yung mga lifestyle illnesses nila because of the worry they have. When you turn that worry into support, pare-parehas kayong mag-grow into yung well-being nyo, mas mag-grow. So, again, if you, yung worry nyo, ano nyo yun, kumbaga, gawin nyo siyang support. Tama ba, doktora? Kasi ganun yung kinalakihan namin bilang nurses eh.
No, tama yun eh. You know what? Rina, kami po, mga doktor kami. So, as we round upon the person, sometimes they want to know, Doc, ano po yung result ng biopsy? So, you say, mag-usap muna tayo. Then you sit down and talk to them and tell them the bad news. And then you leave. Okay? So, eto, may tanning na ba? Diba? Like the question of, ma'am, So, what I could say, when you tell someone that he or she has cancer, then you leave, akala namin bilang doktor, na tapos na yung usapan, di ba? Kasi we ask you, meron pa ho ba kayong mga tanong? Meron pa ho ba kayong mga concerns? Usually, nakanganga na lang po yung mga tao sa amin. Talagang as in, nakanganga na lang sila. Yung iba, parang, wala po, Doc, wala. And then later on, pag alis na po ni Doc, biglang the relatives parang mag-explode yung news dun eh, in the room. And then, lalo na kung confined, the only person na nandun, Reyna, is their nurse. So, tama ka talaga because they need the support at that time. Kami bilang doktor, nag-walk out na kami, tapos na kami doon sa usapan. But, once you hear something like that, hindi naman agad-agad na papasok talaga sa utak mo lahat eh. It can take you 1 hour, 2 hours, 1 day. And by that time, it's only the nurse talaga who's gonna be left there na chine-check yung swero mo. You know what I mean? Tinatanong kung ininom mo na yung gamot mo. And my goodness, the support that a nurse could give during this time is just incredible. So I'd like to state this also, no? Cancer is a hindi lang po doktor ang magiging kaagapay niyo po as you go through this journey. The nurses are so important, the techs, everybody po, your family at your friends, lahat po yan, they will be here to help you. And kung hindi man financial or medical, malaking-malaki po ang role ng emotional support. Okay?
Agree to. Kasi, di ba, burden na sa...
Mga doktor, bad news, and then alis na. And then, kawawa na lang yung mga nurses to pick up the issues. Tama ba ako?
Totoo yan. Totoo, doktora. Totoo. Kaya kami, yung isa sa mga training namin, kumbaga, naging rich sa amin yung being compassionate and empathetic. Iba yung sympathy sa empathy, So, we nurses, empathetic on the sense na akala mo kami yung family member. Because ang doctor kasi nag-rounds lang yan. Ang pinakamatagal na rounds ng doctor.
Nagmamadali pa.
Yes, 5 minutes lang. Babasahin niya lang, titingnan niya lang yung pasyente, tapos na po. Sa aming mga nurses, may iwan yung pag-console. Kasi, let's admit it, wala masyadong bantay or dalawa lang ang bantay o minsan isa lang.
And yung na ngayon, may COVID.
Yes, and yung bantay na yun, runner pa, doktora. We call them runner, di ba? Kasi siya yung magtatakbo. O, takbo mo to sa... Bili mo si patient ng ganito. So, kaming mga nurses ang naiiwan. And yung role namin has to be the family member, empathetic, but at the same time, not, hindi kami dapat hindi kami to step on the role of the support group. We just have to be there. Yes. Kasi pag iiyak ang, naku, doktora, nasa colon, nasa ako dati, anong ba yung tawag doon? Oncology. Yes, the ward. For pedia. Naku, doktora. Sa PGH din.
Ay,
So,
malungkot yan.
sobrang mabigat. It's mabigat. Yun lang, mabigat po. Iba din ang case ng pedia na may cancer. Iba din. Iba. So, mas mabigat. Hindi, you cannot say mas mabigat kasi equally they are on the same
Oh, lahat
ocean.
mabigat. Yes, we're not here to, say mas
Yes.
mabigat yung isa more than the other.
Oo,
We are just here to
no, no,
acknowledge that it's difficult.
no. Yun lang. Madaming kwentong ospital ang mga nurses, doktora. Yun. Okay.
Yan.
Maganda,
So,
no?
guys, marami pa ho ba tayong tanong? Para
Madami
i-preempt
pa,
na yung
doktora.
Oh my
Yes.
gosh. Okay, short answers na lang, guys. I'm sorry, okay?
Yes.
Okay,
Okay.
short na lang.
Okay. Next, Miss Kat. From Chris Nasaire. Good morning po, Doktor. Ano po ba ang signs ng nasal carcinoma? Magandang tanong to, Doktora. Very rare.
Alam mo, Chris, this is nasopharyngeal cancer is a common cancer among Chinese po, and Filipinos are actually quite prone po to nasopharyngeal carcinoma. Unfortunately, a very good friend po of mine and the doctor po na aking nanay developed nasopharyngeal cancer. Okay, where is the nasopharynx first and foremost? Okay, it's not here. Okay, in front of your nose, nasopharyngeal. Um, wala akong picture but siguro let's talk about it. It is ito po in our sinuses and behind the mouth. So it is something that is only seen po through a CT scan, sometimes an MRI, and there are not many po, hindi siya nakakapad. It's common among South, okay? And it is also sometimes related to smoking. Okay? Pero family history might be interesting po. There is really no screening po. And sometimes nabubulag po yung mga tao. I know it's hard, but sometimes nabubulag yung mga tao, but it is not really, hindi siya that common. Okay? And there are no obvious symptoms. I would like to move from this question to share with you another cancer po na wala rin pong symptoms and wala rin pong, it's not so common screening, ovarian. Reyna, ovarian. And it happens in young people. Wala silang nararamdaman. Pagkita mo, biglang lalaki yung chan within 1 week. Pag in-scan mo, ovarian. So, there are cancers po talaga that there is no screening and usually found late. Another cancer, kidney. Wala ring screening yan. Matindi.
Madagdag ko lang sa sa nasal carcinoma, Doc. I have a relative, immediate, who died of this nasal carcinoma.
Mm-hmm.
Grabe din, hindi rin maganda yung prognosis. Mabilis. Sobrang bilis kasi very close to the brain cells.
Hindi maganda.
Yeah.
Yes, tama yun.
And tama ka, Doc, wala masyadong symptoms except that
mahirap.
Malala na siya. Yun. So, okay, next question from Miss Cathy Rodriguez.
Sorry, I would like to add lang, sorry, puntahan lang natin, I just checked sa internet. Wala po talaga masyadong symptoms. And usually po, nagkakaroon po sila ng lymph nodes dito. The lymph nodes already means spread from here dito. Nasa likod po ito ng bibig, behind our nose. So, by the time po pumunta dito, kalat na rin ho yun. So, there is really no early symptom. Yun po.
That's true. So, hindi rin symptoms yung may lagi kang allergic rhinitis.
It's common among Southeast Asian men.
Yeah. So, yun. Okay. From Miss Cathy Rodriguez, what is the difference between sarcoma and carcinoma?
Ma'am, ang sarcoma is a form po of a carcinoma. Carcinoma is also another term and sometimes people use it different from cancer. Carcinoma means cancer. A sarcoma po is a form of a Usually, muscular po lumalabas ang sarcomas. And masses din po. Okay?
From Mr. Raymond Alan Sese, good morning, Doktora. My father ko po died of lung cancer at the age of 65. Smoker po siya and agree with your comment na financially and physically draining. Pero worst part po is emotionally.
I truly agree. I think anyone who has had parents or a spouse or close friends or a brother or a sister, ano talaga, it's hard. I empathize with you po.
All right, from Miss Leonora Page Reyes. Paano po yung stage 2? Ano ang prognosis?
Ma'am, depends po kung ano pong cancer are we talking about. And let me just put it this way. Stage 1 and stage 2, medyo magkakalapit pa po yan eh. And there's still a lot of hope. Okay? So, it depends po. Like, there's stage 2, ano po, lung is still operable. Stage 2, breast is operable. So, iba't iba po. Depende, as I mentioned, different cancers, different stages po. Different staging. Yan po. Okay?
From Mr. Marvin Anora, may katanungan lang ako. Totoo ba talaga? Oh my God, let's just move on from this. May
Mr. Marvin, I swear to the Lord, may COVID. And if you don't believe me, it's time for you to go to PGH and examine the situation for yourself. Kasi sometimes we do not believe until it happens to us. Ang pakiusap ko na lang, do not wait for it to happen to you or your family. Malungkot po yun. And for those who don't believe, pwede hong personal tour ng Philippine General Hospital po. At kung magtutour kayo, tumulong na rin po kayo.
From Miss Nanita Bobadilla Reyes, 82 years old po namatay nanay ko nung inopera po sa gallbladder, nakita. Kuya ko po 59 gastric carcinoma, ate ko naman po is 54, they died 2013, 2014, magkakasunod, and 2015. Yung isang ate ko, na-diagnose early, kaya awa po ng Diyos. Ito yung sinasabi mo kanina, doktora eh. Kaya awa po ng Diyos, natapos na niya yung chemo and radiation sessions. And siguro po masasabi na, wow, cancer survivor kasi 2 years na po yung last chemo niya. Amen. Yun nga lang po, andun talaga yung pangamba sa amin dahil may mga history na from mismong family, pati sa tita and cousins, both mother and father side.
Meron talagang ganyan, Ma'am Ninita. There are people talaga na with very strong family histories. I would like to mention anyway, ano na lang po, no? Si Joey Albert. Joey Albert comes from a family of the Alberts. Kilala po sila for colon cancer. Can you imagine? Would you like to be part of a family na kilala sa colon cancer? Hereditary po talaga sa kanila. And as a consequence, si Miss Joey po was screened early and diagnosed early and naoperahan din po. So, it's very important po to know your family history and then to have yourself screened po depending po kung saan history po kayo mahuhulog.
From Miss Nanita Bobadilla Reyes, my question po is, advisable pa po ba na operahan kapag stage 4 na?
Ma'am, it depends rin po. There are various kasi operations that are done on cancer patients. Normally po, no, if you are operating to cure, if someone is already stage 4, you can no longer cure that person. And the reason po for the operation is usually not to cure the patient. Okay? But sometimes we do operate on stage 4, what we call po debulking or masyado na kung talagang yung the tumor is pressing upon, for example, sa bituka, hindi na kung makadumi yung tao, ganun po. Or something like that is usually to relieve na lang po a symptom. Okay? So to cure someone with stage 4, malamang hindi na po mangyayari yun. Okay?
From Miss Kenny Vasquez, Doktora, normal po ba?
Yes.
Doktora, normal po bang may makakapang bukol pag may menstruation? Pero nawawala rin siya pag natapos na ang menstruation? Pag nakapa po ba, dapat po ba masakit siya o hindi pag kinakapa? Since 1997, nagkaanak po ako sa una kong anak. May umbok po sa kilikili ko nung pinatingin ko po. Laman lang daw, 3 na po anak ko ngayon. Salamat po. Pero ngayon, umiimpis na po yung umbok sa kilikili ko po. Salamat po.
Okay, there are two questions that I am getting here, okay? The first is, can there be breast masses po that vary with menstruation? And the second question po is about the mass po sa kanyang armpit na lumalaki. Okay? So sagutin po natin yung una. Yes, there are what we call fibrocystic changes in our breast na nakakapa po natin. Sometimes they are known commonly po as breast cysts and they can vary po with menstruation. But again, ito lang po talaga, kung may makapa po kayo sa inyong breast, wag sana manggaling sa inyo na hindi sa mens lang to. Okay, no. Go to the doctor, have it checked, and then gagawa po kayong dalawa ng plano on how you can monitor this mass. Okay? Number two, so my answer, yes, there are masses that vary with menstruation and they are usually not cancer. But again, better to go to the doctor. Okay, number two question, yung mass po sa kanyang kilikilan lumalaki. Usually, ma'am, pag matagal na rin po, no, and biglang lumaki, kahit matagal na ho yan, you should actually have it looked at again. There are lipomas naman po or mga benign masses. No, masses can be either cancer, which is called malignant, or hindi po cancer, which is called benign. So may mga benign masses din pong lumalaki and better again to have it patingin. Okay?
From Mr. Raymond Alan Sese, Doktora, ano po ba opinion nyo sa mga alternative meds like dugo ng cobra, herbals, etc.? Minsan, Doc, alternative meds na din po ang pinupush pero di ko na po i-mention names.
Ito lang po, I am a conventional doctor. I was trained po in the Western, I trained in New York City. I worked at Memorial Sloan Kettering Cancer Center, which is the #1 cancer center po in the world for 3 years. And it was really something that I treasure to this day. However, I do realize that Western medicine is not everything. Meron din po namang mga beliefs ang mga tao that can help them through this difficult time. Kaya lang, there are some naman po talaga na nananamantala na po. Okay? And I would like to tell you this sad story about iridology. Okay? And you can just, na lang po, take your lessons from this. And this is a true story. Meron pong dumating po sa akin na 22 years old na bata. She was accompanied, well, hindi na po bata, that's already an adult. She was accompanied po by her mother. So, they went to my clinic po in St. Luke's QC and binasa ko po, nakalagay po, thyroid cancer papillary. So, sabi ko, ma'am, first of all, I'd like to tell you the bad news na yung anak niyo po has thyroid cancer. Okay. But, if you can believe, meron pong good news. Sabi nung mommy, Doktora, what do you mean good news? Sabi ko, well, the good news po is, of all of the cancers po that she could get, ang papillary cancer po is known to be, hindi pa po siya advanced stage, as I said, no? And number two po is, very curable po itong form of cancer na to. And so many people po have recovered from papillary cancer of the thyroid. So, gastusan lang po ng konti and of course, there will be gastos. Pero I would like to reassure you na in the end, gagaling po yung anak niyo who is only 22 years old. So, kasi matagal na po siyang may bukol po sa lalamunan. Okay? Or sa goiter here, a mass here. So, neck mass po yun. Another reason you should go to the doctor. Pag meron nakakapa sa liig, doktor na po. So, umiyak ho ng umiyak yung nanay sa harap ko. So, sabi ko, Mommy, please, malalampasan po natin ito together. I will be here. Your daughter is here. It is a curable cancer. Sabi niya, Doktora, you do not understand. Sabi ko, Mom, bakit? Kasi may trabaho naman kayo, may trabaho naman si Daddy, meron naman hong PCSO, 'di ba? Rina, I'm sorry to tell you and everybody, this is what happened to her pala. May nakakapa po silang bukol po sa leeg. Instead of proceeding to the doctor, they went po to one of these iridologists or kung ano pong iba. they were charged po so much money. They really spent thousands, hundreds of thousands po. And obviously, hindi ko maling yung anak. That's why they happen to come to me sa St. Luke's. Ano po, inubos po yung pera nila from all this alternative therapy. When I informed them po that there is a conventional therapy that can save the life of their daughter, talagang said na pala po sila. So that's one of the stories about alternative treatments that has stuck to me. It has been more than 10 years ago, but I cannot forget that situation po that happened. So I hope that, I don't know, let us just absorb this story po. It is true. Okay?
Well, doktora, may mga tao talagang walang puso. I'm sorry to say.
Walang
Sorry
puso
to say.
talaga. Yes.
Oo. Okay, from Miss Mirna Lakatan, Doktora, anong ibig sabihin kapag may discharge na lumalabas na dugo sa nipple, tapos may nakakapang-numb sa puno ng breast?
Ay,
Doktor.
Ma'am Mirna is a PRC licensed midwife and a caregiver, a licensed caregiver also. Ma'am, if there is a nipple discharge coming out, especially from an older person who's not pregnant, along with breast lump, cardinal sign po yan of cancer, you have to go and have a checkup. Or please advise that, not you, please advise said patient to immediately have a checkup. Hindi po
Alright.
maganda.
From Miss Cathy Rodriguez, do you think, Doc, immunotherapy will work for cancer treatment? I've
There
heard
is
that
an, sige.
I've heard that before there is a clinical trials for clinical trials works for stage 4 cancer totally healed.
Marami na po. There are new drugs being used. For breast po, Herceptin was one of the first, and nakakatulong po talaga sa yun sa stage 4. There are many trials po under, but the bad news, mahal po itong mga gamot na to. And that they need to be taken for life.
Okay, next from Miss Nenita Bobadilla Reyes. Sobra pong nakakadurog ng puso nung malaman ng nanay ko na may cancer siya. Kasi pilit po namin talaga tinatago sa kanya kasi nga baka mawalan na siya ng will para pahabain pa buhay niya. When she heard about it, umiyak po talaga siya. We were advised not to ipa-undergo pa siya sa chemo kasi di na raw po niya kakayanin.
Ma'am, it's really difficult for us to make the decision to find the courage to tell people the truth. And I guess it's in our culture po that we try to hide these kinds of diagnosis for persons. Kaya lang po ako, I was trained in the Western manner. And I guess, nagbabago na rin po ang Pilipinas. And um, people have told me, don't tell my mom. But if your mom asks me, I would really have to tell her the truth. Kasi I do not also want to lie to patients. So ako, ang advice ko talaga is consult the doctor at saka po yung family members. And sa mga situation na ganito po, I would really like us to inform the person. Kasi um, baka kung may mangyari and then masisi pa tayo ho ng pasyente na tinago po natin yon, and then we lose the trust of the person in the process. So it's very important for me to have trust, but as we tell the truth po, we also have to give hope. Yun lang po. Kasi Reyna, mabigat din pag sinabi sa'yo ng pasyente, Doktora, I no longer believe you and I do not want to follow you because you did not tell me the truth.
Oo, Doc. Well, this applies to basic life learnings. People deserve the truth. Lalo na kung sila yung involved. No matter how
Well,
hard it is, you just have to tell.
I agree, Reina, but having been in the position also that my mom had cancer lahat, mahirap din. So I cannot blame anyone for lacking the courage to tell the parents. What I usually tell persons is work together with your doctor. Sometimes they will ask you, Doc, can you please tell my mom or my husband or my wife in the most compassionate manner that you can? And pinag-aaralan nito ng mga doktor. Just like tinuturuan rin kayo ng mga nurses, bilang nurses.
Yes. Opo.
Sensitive po ito. Ako, I cannot blame one person one way or the other kung ano, lalo na sa kultura ng Pilipino. Okay?
Yes. I agree, Doc. I agree. All right,
Kaya lang
next.
hindi naman tayo pwedeng mag-opera ng mga taong hindi nila alam kung bakit sila inoopera. Diyan
Totoo.
talaga ayoko na. Ayoko na talaga doon.
Madedemanda tayo doon, Doc. That's what we
Ay,
call informed consent.
but it is happening.
Yes. Pero 'di ba, Doc, tama naman, that is informed consent. You have to tell the
Yes,
patient.
you need to know. Then you need to know talaga.
Oo. All right, from Miss Mirna Lakatan. Good morning po. Watching po now here in Taguig. Okay, what next? From Chris Nasaire. Thank you po, Doktora, sa info.
Yes, Chris, I'm sorry talaga. Mahirap ang nasopharyngeal. Thank you.
From Miss Mirna Lakatan. Thank you po. Nasa abroad po kasi siya ngayon.
Okay, please advise her, ma'am.
From Miss Maria Gina Bahilio Gundao Tanza. Hello, Doktora Ana. Feel so good to see you again. Medyo busy po sa online class, etc. Ingat po kayo palagi.
Ma'am, take care also and stay safe po.
That's all that we have for today, Doktora.
Okay. Until
Yeah.
then, a lot of questions about cancer, a lot. And, I hate to say this, cancer is my favorite topic. Sama eh. But really, I was trained in a cancer hospital. Persons close to me have passed away from cancer. So aside from the medical knowledge, as I mature and go through life, I also learn the life lessons from cancer. Kasi nung bata ako, I used to know everything. Parang wala. I mean, I thought na I was invincible. Parang 'di ba pag bata ka, ganun eh. Malakas ang loob mo, you just graduated from med school, you're a hotshot doctor. But you go through life, your parents develop cancer, close friends pass away. These kinds of things leave lessons in your heart for you to learn from and to pass on to your patients. So sa inyo pong lahat, magandang hapon po.